Good afternoon, Davis Month, and I'm Chief Master Sergeant James Lott, Command Chief of the 355th Wing, and I'm back indoors. It's Monday, 27 April, and I'm back underneath the four fans of freedom. It is Monday, and like I told you guys on Friday, Colonel Jolly's playing a little bit dirty these days, so he's making me do Monday morning videos, knowing that there's not a whole lot of updates over the weekend, and his hunch was correct. There's not a whole lot of updates over Saturday and Sunday. However, I'm smarter than the average bear. So today is Medic Monday, and I know that Colonel Jolly was probably planning to cover down a lot of these things on Friday, but again, I'm smarter than the average bear, and I brought along the honey badger with me today.
Good morning, Chief.
Sir. So, sir, there's been a lot of questions about testing, about antibodies, those types of things. We've got a lot of those questions in. We've gotten a lot of questions about the HPCON, a lot of questions about curves and models and things like that. So I wanted to ask you to come on with me today, and we would just kind of talk about a few of those things and
Sure.
get the truth data out to the folks here at DM. So
Absolutely.
So first and foremost, HPCON Charlie has been extended for 30 days. So what does that mean to us here at DM?
Right, so the public health emergency has been extended for 30 days. So again, that gives Colonel Jolly the necessary legal authorities to ensure the force protection and health protection of our entire population, whether employees, active duty, or dependents, or anyone who's living on the base. And so really it's just another way for him to ensure that we can meet our national security missions as well as protecting all of those who live and work on Davis-Monthan.
Awesome. So models. Colonel Jolly's talked a lot about models. We talked about models during the Facebook Live, and we even sat in on an ACC conference with some of the ACC scientists, and I think one of them even said that there's two things that we know about models: is one, all models are incorrect, and some models are useful.
Yes. Yes.
So we talk a lot about models. We talked about them in the Cubs. Can you kind of talk about the different models that we have out there and what they're saying about Davis-Monthan and our area in general?
Sure. So there are multiple different models, all instituted or run by different universities, different scientific organizations, and they all take in different variables and different inputs, whether it's from local county health departments, from state government officials in terms of what the states are doing in terms of restrictions, all the way through fatality rates and things of that nature. And so there are many different models, and like Chief said, very variable reports from those models. So one model basically says that Arizona has already reached the peak. There's another model that says that we might not hit the peak until June 12th. And then there are a couple of other models that say that probably in the next 2 weeks we're going to hit the peak. So again, a huge variety in terms of the time frame and a huge variableness in terms of what factors they put into those models to come up with these predictions. But ultimately, the real takeaway point is that all the models kind of show that most likely Arizona will have the capacity within the local hospitals to handle the peak case or the peak incidence of total cases of COVID patients. So that is the key takeaway. Whether it's in June, whether it was last week, or whether it's in the next 2 weeks, Arizona is anticipated to be able to handle the highest number of COVID patients.
Awesome. So since the very beginning of this, we can go back about 6 weeks or so. General Holmes talked about flattening the curve, right? Flatten the curve, flatten the curve, flatten the curve, and it kind of feels like we're moving towards that now. So I know that you put out some information on places like Florida and Washington and Colorado and how we compare to those places.
Sure.
Can you speak to a little bit about how we look in relation to those areas?
Sure, absolutely. So Arizona right now, in terms of the growth curves of new cases and fatalities, is below Colorado, Washington, and Florida, for example, as well as other states. But those are some key examples where there used to be some hot spots in the country. And so that's great news for the state of Arizona and us here at Davis-Monthan, that we are below those equivalent curves, if you will.
Awesome. And so I think it's important for everybody out there to know that, General Holmes talked about flattening the curve, but he also talked about fighting the virus. So we've got a lot of talk on the TV and news about folks going back to work, opening the states back up, and we also hear about getting back to work here, readiness. I think it's important, for our folks out there to know that while the nation is moving in that direction, we're still fighting the virus.
Absolutely, and it's absolutely crucial that we continue on that path. So Most data shows that Arizona in general is growing at a rate less than 5%, somewhere around 3% or so, give or take, when that's great. So that means we have a really slow increase in cases. However, it's key to note that the word increase is still in there. We have not plateaued and we haven't hit the downward slope. So we are still very gradually increasing. And so we need to continue our fighting the virus policies, whether it's social distancing, hand washing, or wearing the cloth face coverings, and ideally a combination of all three of those to help mitigate transmission and mitigate the risk to all of us around. And that way we can still focus on generating some mission readiness or readiness capacity.
All right, and last but not least, one of Colonel Jolly's lines of effort is to provide the best care to our team. And we talk a lot about COVID, and over the last 6 weeks has kind of been our priority. But I also know that your clinic is providing other services like the Raptor Clinic. I got an opportunity to go over last week, and Doc Choi took good care of me. He gave me a brace for my wrist. I don't have it on now. I took it off for the camera, but he gave me a brace for my wrist. And I want to give you a moment to give a plug to your guys over there.
Yeah, so special thanks, first of all, to all the Honey Badger medics out there. Everything that we're doing is for us to help you. So thank you for trusting us with your care. We're absolutely honored to take care of you and your families and on all of our beneficiaries. But honestly, it's not just us, it's all of our fellow brethren medics out in the Tucson area, in the state of Arizona, and across the entire DoD. We're all in it together. What we do on this base impacts our community, and what happens in the local community impacts our base. We are that intertwined. And so all the medics around the entire globe deserve an amazing kudos and an amazing thank you, in addition to all the first responders and those that are keeping the country going. Because without that, the ramifications of the mitigation spread or the lack of mitigation would be potentially horrendous. And so thank you to all the Honey Badger medics. Thank you for taking care of Chief Lyda's wrist. It never looked better. And thank you to everyone out there for everything that you're doing to wash your hands, keep your social distancing, and wearing your cloth face mask.
Hey, Doc, thanks. So I know Colonel Jolly probably wanted to have you on Friday to get this out. I'm really glad that you came on with me today. I think it's important that you show up here on Mondays versus on Fridays because my audience is a little bit larger than his, and you get a larger reach and spread. You got
to spread the word.
Exactly.
All for public health.
Exactly.
Wellness. Yes, resiliency.
So, guys, I'll ask that you reach right down there in the corner, press that little thumb for me, and I look forward to seeing you guys again on Wednesday for our combined Boss and Buddy on Wednesday at 1600, and then again next Monday. Colonel Jolly didn't look at his calendar because he gave me May the 4th. So May the 4th be with you, and we'll see you guys next Monday. In the meantime, keep doing what you're doing. Take care of each other. Take care of yourselves. Go wash your hands. Rescue and attack.